Hi, my name is Bernadette, and I am Bernadette McFadden, and I am one of the students here at Joyce. Today, we are going to be going over the parent perspective reflection for Nursing 235. So, with this video, we had a child who was chronically ill. Um, and it seemed like she had a lot going on. Patient was diagnosed with cerebral palsy, epilepsy, autism, dysphagia, anxiety, hip dysplasia, and hydrocephalus. Um, with this patient, she definitely had a lot. She was born premature at 29 weeks. She had twin transfusion syndrome. She gained a lot of pounds, overload here. She went from 3 pounds 4 ounces to about 9 pounds plus. Patient had heart, liver, and kidney failure. Just some of the few things that were going on, feeding difficulties, and she was in the NICU for roughly around 180 days. How overwhelming, one for both mom and baby. I had a child who was in the NICU for about 15 days, so not definitely nothing long as 180. So I could only imagine how mom and dad were doing during that time and stay. We have a few questions here, and we'll start off with the first one. The first question is going to ask, why is family-centered care important? Of course, during the video, you definitely see mom and dad advocating for baby, which is going to be number one. Usually babies cannot speak for themselves for the first couple of years of their life. So they're going to depend on mom and dad to kind of advocate for them, their concerns, their worries, anything that may arise during the care and treatment of their baby. The next question asks, how can chronic health issues impact family dynamics? So usually when you have someone who is chronically ill, they have multiple health appointments throughout the week, which can sometimes interfere with the normal 9 to 5. Some parents may struggle with keeping a job, whereas others will have to get the necessary accommodations to keep their job. It's going to be a lot, but organizational skills will definitely work in this type of situation, to make sure that everything is still within perspective, but also managed well. Timing is everything. Aside from taking care of baby, you want to make sure that you have time and that you do take care of yourself as mom and dad. The next question, what is the impact of chronic health issues on a child's growth, development, and quality of life? So when we talk about the impact of their diseases, it's a fluctuation of things. As we stated, having to go to different types of doctors. This patient had a variety of doctors: a cardiologist, an oncologist, a psychiatrist, a psychologist. A lot of providers are going to be incorporated in the care and treatment. So that's going to be different from someone who's just going in for their annual physical. Everyone will have to coordinate the care, communicate with each other to make sure that there's no disruption in care and treatment for the patient. The next question, how will this perspective impact your future nursing care? Intercommunication is going to be the key here. Making sure that all of our providers are on the same page will prevent errors. reaching out to those providers when necessary if you need a follow-up to a question or a concern that has arose. Um, it, it it takes a village, especially for someone who is chronically ill. Um, in this video, mom showed extreme endurance for running the race for her baby, and I don't think that I would expect to see anything less, because I do the same plus. For sure for mine. So it was a great video. Good to see how some can be knowledgeable, but also just making sure that you're voicing all of your concerns and issues to the providers. Never be afraid to speak up. This was a great video. Glad to see what scenarios could arise with someone with chronic illness.